Hello, and welcome to the Hawaii Book and Music Festival, the wellness track. We're beginning a 1-hour panel on long COVID. You know, we've been through surges, we've been through questions, we've been through waiting for vaccinations with COVID-19. Just 30 to 40 days ago, the state was at a peak of cases. We were concerned that the hospitals would be completely overwhelmed or on the verge of being overwhelmed. And now the last 3 to 4, 5 weeks, we're seeing descending numbers. It looks like the worst is behind us on this surge. And there are calls for lifting mandates, returning to life as normal, getting our lives back, getting our holidays back. But there's one piece of the COVID pandemic that persists, and we read about it, we hear about it from time to time in Google or in the papers. But long COVID, this idea of not just getting COVID and getting better, not just getting COVID and passing away, but getting COVID, getting over it, but still having pain, discomfort, shortness of breath, disability, organ problems for a long, sometimes a very long time. That's the topic of this panel. I'd like to introduce some notable experts who will be discussing their role, their research, and the recommendations on long COVID. First, we have Dr. Bennett Loui. He's a primary care provider at Straub Medical Center, born in Honolulu and studied at Brown University in Thomas Jefferson. He did Chief Residency at University of Hawai'i, and he's currently the Chief of Internal Medicine at HPHMG, and he directs the long COVID care program at Hawaii Pacific Health. Dr. Loui, welcome. We also have with us Dr. Natasha Ching, and Dr. Ching is Assistant Professor of Pediatrics at the John A. Burns School of Medicine at UH, and she's also a pediatric infectious disease specialist at HPHMG, working at Kapilani Center. She's been involved with COVID-19 on the treatment of pediatrics and has developed diagnostic and treatment protocols. Welcome, Dr. Ching. And Dr. Neal Palafox, good to see you again, is MD, MPH, Master's in Public Health, currently Professor of Family Medicine and Community Health at the University of Hawai'i. He's a member of a 4-state COVID-19 response team and has been the University of Hawaii West Oahu COVID-19 contact in the contact tracer program. Welcome, Dr. Palafox. So we are going to have each of our panelists speak for a few minutes, and there'll be an opportunity for questions and dialogue to follow. I think find this to be an interesting panel. Thank you for tuning in. Dr. Loui?
Hi, thanks, Ira. I really appreciate the invitation to be here, and thank you for those who are watching. This is a really important topic to me. Introducing myself, as Dr. Zunin mentioned, I grew up here in Hawaii and was away for school for a number of years, but it's really great to be back practicing in Hawaii and serving the community that I grew up in. I've been at Straub for a number of years now, and I've had the honor of being involved with the long COVID program for Hawaii Pacific Health. We've been enrolling patients since the end of 2020, and I wanted to share some information about long COVID in adults and a bit about our program. So thank you. I'm going to start sharing slides now. And long COVID. So there are a lot of names for this condition as we are learning about COVID and the long-term effects. You might have heard long hauler syndrome, post-acute COVID-19, and some other terms. And we're starting to define this better with the WHO and CDC settling on a condition that is associated with a spectrum of physical, social, and psychological consequences. And we start really considering it long COVID at least 4 weeks after the onset of symptoms. It's looking more like we would really consider after 2 months to 3 months as of the most recent consensus with the WHO. Long COVID can happen in people who are severely ill, or even if illness initially was mild. And there are some great effects on the individual as well as the entire community because of this long COVID problem. How common is this? Well, it depends on which study you cite, but initially reports were coming from all over the world on different populations and with different levels of looking at different types of conditions, because we didn't even have a definition for what long COVID involved. But out of Europe, Asia, and US, some of the numbers that you might see are long COVID being present in 10 to 13% of all comers who have had a diagnosis of COVID. And after 8 weeks, 5% are still reporting conditions. The hospitalized population is more ill, and a third have been reporting or long COVID after a month. There was a study in China that hospitalized patients that after 6 months, most people still had some symptoms. Even after asymptomatic infections, a population study noticed that about 19% of these patients sought treatment for COVID-like conditions. So the numbers are out there, and if you do the math out of the millions of people in the world that have had COVID, you can imagine how many millions have long COVID. And in Hawaii, there must be thousands. What puts you at risk for having long COVID? Severe illness, as I mentioned, being in the ICU on a ventilator does increase your chance of having long-term symptoms. We've also noticed higher rates of this in the obese, heavy people. Older age is associated, and women tend to have more long COVID incidents than men. History of illness, especially chronic conditions, especially respiratory disease and anxiety and depression, are also frequently associated with long COVID. What is happening with this? And there are a lot of theories. It's probably a combination of different mechanisms that cause long COVID, including just recovering from severe illness in post-intensive care syndrome, inflammation, blood vessel injury, immune system problems that follow this severe viral illness, or even the persistence of the virus in the body that's been sequestered away and comes out over a long period of time. So there are a lot of theories that are being tested out right now, and there probably is more than one explanation for the syndrome or the condition. I'm not going to go into great detail over all of the different things can happen. What I want to communicate is that this really can affect all aspects of life and health, including general fatigue. There is a severe type of post-exertional malaise that many people who have had COVID report. Just going out to a grocery store can put them out for days. And even athletics people who have a really high level of capacity before illness can become very ill, very fatigued for a long period of time. Brain fog is a very commonly reported symptom. Headaches, cough, and difficult breathing, very common. Chest pain and palpitations. Anxiety. Quite a few people have hair loss and persistent loss of smell. And it goes on and on. But something that is really something we need to recognize is that these persistent symptoms can really impair a person's ability to get back to their normal lives, get back to work, get back to engaging with family. And so it's important that we recognize this, and in those that we know that have had COVID, we should be sensitive to this, this being a problem. Here locally, and well, around, in all communities, there's been a focus on trying to take care of people with long COVID. Here in Hawaii, the bigger programs are the Queens Post-COVID Recovery Care and Care Clinic. It's based at Queens Punch Bowl, and this involves in-person evaluation. It's a really nice comprehensive evaluation, and so that is open to referrals from all around. The Hawaii Pacific Health, which is the clinic I direct, is a virtual clinic in which we have providers contact and follow patients with long COVID over time by video or telephone. And it's important that we coordinate with the primary care doctor. So we take referrals only from the PCP. And I'll tell you a little bit more about what we're seeing. For long COVID, we like to know that there was a documented positive COVID test. Some people will come in with symptoms and think they have long COVID, but they actually never had COVID. So we have to kind of sort that out. There's an antibody test out there if there's uncertainty, and sometimes if we find a positive antibody test, that would make it clear that this person did have COVID-19. And of course, we are looking at people who have had symptoms for at least 4 weeks or longer.
So, here we are in October of 2021, moving forward. And so what's been going on with pediatric patients? Well, initially, I know I had to speak in March of 2020 when we had no data except for what was out in China. And, in the beginning, the initial reports are children, teenagers had mild or no symptoms. But as this whole pandemic has been evolving with multiple new data every day or every week, we have seen many different situations where children can have severe disease, needing hospitalizations if they have certain conditions, just as adults needing to have oxygen, respiratory support, eventually, possibly even a ventilator. But children now also have multiple episodes where they've been reported with long COVID, with really many similar situations and symptoms that Dr. Loui has mentioned. So I won't go into it. But basically in the UK, they've shown about 52% of teens and young adults that have had lingering symptoms. And specifically, children were reported to have symptoms 5 weeks after infection, and the range is between 13 and 14% in children between 2 and 11 and 12 and 16. It's an international tour of who's reported what. But basically, one of the early reports were 5 children, a small case report in Sweden where patients had long COVID and really were unable to go to school, really had difficulty eating and daily living activities. An Italian study looked back and saw almost 43% of the patients had one symptom present 2 months after an acute COVID infection. Israel reported following patients prospectively in a pediatric multidisciplinary clinic, and they found that 60% of the patients had some persistent symptoms with a large range between 1 and 7 months. And the top 4 symptoms they talked about was fatigue, dyspnea, body aches, sleep disturbances, and as well as the multiple list that has been seen previously. And I think the other part to bring home is that many of these long COVID cases were noted to be after mild disease or even no disease, the asymptomatic disease. And that's important to think about. If we say the majority of children may have mild or no symptoms, this still is a potential possibility for pediatric patients to be considered for long COVID. But the second part of long COVID is a little bit different, and what I wanted to talk about was the multi-system inflammatory syndrome in children associated with COVID-19, or MISC or MIS-C. And this is a rare complication that can happen 2 to 4 weeks, even up to 6 weeks after an acute COVID infection. And the CDC has their own case definition. Back in May of 2020, Europe was seeing this. New York State had a health alert, and really everything culminated in May with this clinical syndrome. The case definition is you have to have a fever for at least a day. You have to have lab evidence of inflammation with blood markers, and really at least 2 organs are involved with no alternative diagnosis, but positive history by testing either molecular or serology for prior COVID-19 infection, or an exposure or a household contact, thinking back to the beginning of the pandemic when testing was difficult to make an epidemiological link. But if you look at this graph on the right, you just think about all the different systems that could be involved. They may have fever, body aches. They may have on their face a body rash. They may have red eyes, swollen lymph nodes in their neck. They may have neurological findings with headache, and they may have cardiac inflammation of the heart. They may have coronary artery aneurysms. Lungs may be involved, requiring oxygen, chest pain. Patients can have low blood counts. They may have kidney failure, may have gastrointestinal symptoms, really with severe abdominal pain. And all of these, there are many other different markers, but this is the syndrome that we're concerned with really in patients who really could have mild or no symptoms and present later on after their initial mild illness with this. So where we are in the US, there's been at least 5,217 confirmed cases that the CDC has kept track of, and 46 deaths. And you can see these numbers have, they're up from the original about a year ago, October 2020. And on the left graph, if you look at the right axis in black, that graph is showing the daily COVID cases. And then on the left y-axis in blue, it shows the daily MIS-C cases. So you can see that the MIS-C cases follow the peaks of COVID-19 acute infection. So this is exactly what we're looking for on alert, and are starting to see here after our surge, patients that are presenting anywhere from 2 to 4 weeks or up to 6 weeks with this clinical syndrome. And the concerning thing that it is an acute illness, they are very sick, and they need to be hospitalized for treatment and diagnostics. So, another example of where children can be affected after COVID infection, a little bit different than the long COVID that we've been talking about. The median age is about 9 years, and most of the patients, almost 40%, are between 6 and 11, but it can be up to 21 by age definition. And there is a MIS-A, multisystem inflammatory syndrome in adults. But here's just kind of a graphic to describe from left to right what happens. Patients may have a SARS symptomatic or asymptomatic disease without a close contact. They'll then present with fever, and they can have either a Kawasaki-like disease where they have the fever with red eyes, rash, mucosal involvement, lymph nodes, similar to Kawasaki's disease, which our clinicians are very alert to here in Hawaii. Or they may have shock, which they may present with low blood pressure and need to be in the ICU. And the main concern that we have is that there's multi-organs involved. This whole system, they're in a hyperinflammatory state in terms of all of their labs. And the 2 big concerns we have is the heart. They may have function problems, so the heart is not able to pump blood to the rest of their body. And they may have coronary artery dilatations, which can lead to coronary aneurysm, which can be pretty deadly. So the main thing is that we have a diagnostic and treatment algorithm that we've alerted many of our clinicians in the clinical practices in the outpatient, the hospitals, and the emergency rooms. And the treatment is to decrease inflammation and try and allow recovery, monitoring of these cardiac patients. So really, this is another long-term follow-up that patients have. Once they're treated in the hospital, they have a long-term follow-up that we're still determining, following these kids up to a year to see what their body is really, how their body is affected by this hyperinflammatory process. So another thing to consider is how has COVID affected children besides being acutely ill, besides having long COVID or post MIS-C? And really, this is just kind of a quick look at 6 different areas. Education, children we had school closures, we had distance learning. There are multiple social determinants of health that may have had difficulty with children attending classes, or children don't want to pay attention to the computer and be on the monitor. We have special ed children that need real one-on-one assistance. So that was another way children are affected. When we think about children, the development is from preschool, elementary school, intermediate school, high school. There's all types of socialization that happens in school or with their peers. And, this is something that really can create a difficulty in children making friends, interacting with people, let alone maybe being fearful that they're going to get COVID if they go back to school or participate in activities. Besides interacting with their peers, they're not interacting with adults, with their teachers, with their coaches. And, that's another part of how COVID has affected children. We know physical activities were limited, sports, club sports, team sports were shut down. And so that's another way that our children didn't have increased activity. We know that there was an increase in the percentage of obesity reported recently. I know when I looked, earlier in the year was about 11%. The last report that one of our colleagues, Dr. Mayo Kuhiro, had talked about, the numbers are up to 14%. Kids aren't walking around, they're not walking to school. And then extracurricular activities, we know everyone's life has been changed with COVID, but that's specifically important. There's no Cub Scouts, Girl Scouts, or there's a whole different level to how activities occur now. And really the last point, and I know there was a very good seminar at this festival on mental health and isolation, and that's something that we need to think about. So I think that there are, 3 areas, that children have been affected in COVID. And when we look at the numbers, my hope and the glimmer of hope that I see as we've had the eligibility of vaccines go down to 12 years is the next up and coming group, 5 to 11, looking forward to trying to prevent these severe diseases, these severe MIS-C and long COVID with vaccination moving forward. But even with this vaccination, we still need to consider all the other layers of masking, hand washing, staying home when we're sick. And I feel like all of those things can try and prevent our keiki from being affected by COVID in these ways.
So what I'll be doing is really briefly is talking about the emerging terms and definitions of long COVID, the societal impact, the uncertainty, and several speakers talked about that, the healthcare system's impact, particularly the healthcare providers' impact, and just learning about the diagnosis and treatment that Dr. Loui talked about, and it's not easy and it's new. And so how does that affect providers? And then some general questions for researchers and the community. So emerging terms. So as Dr. Loui mentioned, just so that the terms become more user-friendly, long COVID has been termed different things over time. It's been called long haulers COVID. It's been called chronic COVID, long COVID as we're using, and it's called PASC in many of the current settings, which is post-acute sequelae. So after the acute situation, what follows after the SARS-CoV-2 infection. And the PASC definition is further broken down depending on who researches it, but certainly it's usually 4 to 12 weeks beyond the acute infection. And then there's another phase that people are now breaking it down into, as you learn more, 12 weeks after the onset of the acute infection. But again, some of these are descriptive, some of these are research, but these terms will be fired at you in the general public, but they're essentially wanting to frame similar long COVID, the long COVID illness. So one of the things that, as was described, and to understand long COVID, and so the natural progression after symptoms is usually the PCR test, which tests for the, it's a molecular test, which tests for the genetic material of the virus. Usually after the symptoms occur, 4 weeks after, it sort of really goes away. So the PCR turns negative. And so what long COVID is things that happen after there's no detectable or very low detection rates of the PCR. There's no detectable genetic material, and the actual COVID virus is supposedly not active. And so what Dr. Loui was mentioning and what Dr. Ching was mentioning is this is what long COVID is. It's what happens in the months after this. And they both really presented an idea of what happens with, in the long term after this, but this is why it's defined this way. So, one of the things that presents an uncertainty is, and Dr. Zunin mentioned this, is that we're learning as we go and everything about this virus, whether it's, vaccinations and medications, use this, don't use this, how to test, how not to test. But one of the things that we can look at is the SARS-CoV-1 and MERS were both coronaviruses. One was an epidemic in 2002. The other one, MERS, was Middle East Respiratory Syndrome, 2012. Again, both MERS and SARS, but both of them had long-term effects. And I only bring this up to show you that we're, Dr. Loui and Dr. Ching were mentioning, 9 months out, 12 months out. These studies all showed, and it was studied, that there were effects 24 months out. And it was 2 years after the illness, 29.6% of the healthcare workers didn't return from, SARS, and there were a lot of, and this was actually quantified, but I don't want to go into the actual data itself, but 52% of SARS survivors had impairment at 24 months or 2 years after the illness. So again, we're on a curve of learning. We don't know what's going to happen, but it's to adjust to that. This has been a learning curve for the entire society, but certainly for the physicians and the scientists as well. And we're learning as we go, but it's being patient with it and adapting to change and what that means. So the multidisciplinary team care. So Dr. Loui spoke about this a little bit. And so as he mentioned, long COVID affects multiple systems, and it takes a wide range of experts to deal with it. And because it affects the pulmonary system, the blood system, the kidney system, the renal system, and certainly a lot of the behavioral neuropsychiatric. And primary care is where I sit. And there's a coordinating part of this. So in other words, it will take the health system some maturity to adapt to this, because you can notice that, Dr. Loui in his clinic and Dr. Ching in her clinic has to deal with, the COVID, long COVID, but a lot of it over time will grow, and it needs to end up in a multidisciplinary setting, and that system has to adjust, and all of the different providers and experts have to learn about what this is, what it isn't, how to make the diagnosis, and what their exact role is, so that we can take care of the patients really in a multidisciplinary team medical care setting. So I'm showing this because one of the things about COVID-19, this is Hawaii specific, this is data as of October 11th. Remember, Dr. Bennett and Dr. Ching mentioned that, there's certain risk factors that increase your possibility of long COVID. And one is if you're hospitalized, right? And so look at this graph, and this is state data right off the state data system. If you look at this, 4% of Pacific Islanders, which are Samoans, Tongans, and the Micronesians, make up 4% of Hawaii's population are Micronesians, but of that, they represent 20% or fivefold the hospitalizations from COVID. Native Hawaiians are overrepresented by 2% in hospitalizations, but the other population is Filipinos. They make up 16%, but have 22%. So what this means is that you're going to see a larger percentage of long COVID just by the fact that they have more hospitalizations, and they have also carry a lot more of the COVID-19 infections. These are the deaths, so it shows you the impact of COVID. So again, Pacific Islanders, in the state of Hawaii, 4% of the population, but they're owning 20% of the deaths. 20% of this 815 are Pacific Islanders. 22% are Filipino, but they have 16% of the population. Actually, from a death standpoint, the Native Hawaiians are below their representation. So again, there's not an even distribution of hospitalizations, of COVID-19 infections. And also, it probably speaks to what Dr. Loui was saying in the obesity realm. Pacific Islanders, Native Hawaiians tend to be, in general, again, lots of reasons for it, heavier, a lot more chronic conditions, but it speaks to why we have to pay attention to the different populations and how they are hit and what that would mean to our systems, our providers, in understanding how to work with this.